Good evening, welcome to the programme. This evening I'm in Mallow to meet Ennis-based Michael Doherty, who's been involved in the field of healthcare for the past 25 years. His focus has been on bioenergy, on all aspects of the mind and body system, and looking at the reasons why people fall ill in the first place. I also meet Prof Fergus Shanahan, Chairman of the Department of Medicine at University College Cork. 2 years ago, Science Foundation Ireland named him as its Researcher of the Year. Most of his present-day research has concentrated on the connection between gut bacteria and serious illnesses. We now seemingly have advanced dramatically from the old saying, we are what we eat. Also in this two-part programme, we look at the pros and cons of statins, medication prescribed for people with high cholesterol. We meet Galway-based Sherif Sultan, Professor of Vascular and Endovascular Surgery. He's a Senior Consultant at University College Hospital, Galway. Michael O'Doherty's patients include Michael Flatley, Brendan Grace, Matt Malloy and Atomic Kittens Natasha Hamilton and Liz McLarnon. He's at pains to stress that he does not replace traditional medicine but supplements it. Michael has developed a specific health programme which is designed to look at our energy system, look at the mindset of the patient, how they deal with their emotions, their nutritional history and how to improve it. They should leave him, he says, with the skills they need to confront any issues they have in their lives, which should lead to a better lifestyle and life. So the emphasis, he believes, should be as much on the mental reasons for our illnesses as it should be on the physical.
Absolutely. I think what we need to do is to realise that a lot of the physical symptoms that we see today in the modern type of illnesses, whether it's fatigue, whether it's digestive problems, whether it's asthma, any of these types of things, we focus a lot, John, on the physical things, thinking that, well, we'll take a pill and it solves our physical problem. And while the short-term relief of pain or inflammation is fine, ultimately we need to find out why the problem exists. And with that in mind, over the last 25 years, we've been able to identify the causes of these issues, because I think there are three key questions you have to ask. One is, where is the problem coming from? 2, how is it affecting you? And 3, how are you confronting it? So the vast majority of people know where their problems come from. They know where their back pain comes from. They know where their digestive problem comes from. They know where their headaches come from, or whatever the problem is. They know the way it affects them. It affects their life. It makes their life very, very difficult from day to day, waking up with pain, not being able to sleep properly. All of these things, having no energy. All of these things that people are faced with now, the continuous stress load that exists in our society. And what happens then is the way they're confronting it is wrong, because we're conditioned to believe that if we have a problem, we go to our GP gives us a capsule, we expect that, and this will solve our problem. The reality is, society is beginning to waken up out of the illusion that health is not found in a capsule. It's not found in a bottle. We need to educate society to confront their problems in a different way. And that's what our focus has been over the last number of years, John.
Michael O'Doherty is a bioenergy practitioner. He's based in Ennis in County Clare. Bioenergy uses life-sustaining energy of the universe. Sometimes it's called prana, ki or life energy. It's used to balance the energy body and to create healing.
I think it's very important for people to understand that this is a fundamental part of who we are and how we function. We know the body is made up of electrical activity, for example. We can measure the heart electrically. We can measure the brain electrically. We use MRI scans, magnetic resonance imagers. We use PET scans, all designed around understanding the electrical activity or the electromagnetic activity of the body. If we take any individual and we break that individual down to its cell structure, the cell to the molecule to the atom to the subatomic particle, what we find is energy. The body is made up of energy. Professor Valerie Hunt, who worked with NASA, spent 25 years, and anybody who wants to look at her book Infinite Mind, spent 25 years mapping the entire bioenergetic process of the human being. She concluded that for all of the systems of our body to function correctly, whether it be the digestive system, the muscular system, the respiratory system, cardiovascular, hormonal, any of these systems, for them to function properly, the energy energy system has to be flowing. So the energy flows through our body through meridians, like channels that run adjacent to the nervous system. For thousands of years, Eastern cultures are very much aware of this and developed this. We alienated ourselves from that because we went down to drug-based system. So the energy flows through these meridians, and technically this energy is what triggers the healing within our body. If that energy system then becomes imbalanced or blocked, if you or I or anybody listening to this program goes through any degree of trauma or stress, or if you find yourself in an environment where that's traumatic or shocking, or you panic or whatever, what happens is our first point of contact to the world is through the energy system. So the energy system overloads, and this creates blockages and imbalances. So emotional trauma or stress, children who have birth stress, anything that we encounter in our life that's negative, working in a negative environment, all of these things affect the flow of that energy. And once you affect the flow of that energy, John, the body systems don't function properly, then the body starts reflecting symptoms as a result of that.
Once you do that, unblock these blockages, so to speak, what benefits can you expect?
I mean, the benefits are enormous. I mean, the benefits are huge. If society could be educated, and this is our plan over the next 12 months, is to communicate this information into the family homes, where we can teach people how to connect to that energy, how to focus on it and work with it. It's not just the immediate benefit from the work we will do, where people can feel relaxed, feel the symptoms practically eliminated, feel they can sleep better and all of that. But on a day-to-day basis, John, if people were able to apply the system that we teach them, then they can have that ongoing. It means that on a daily basis, they work with the energy by doing breathing, visualization, getting a little bit of exercise, just being conscious that the body is made up of energy, taking the time to deal with that on a daily basis. The implications are huge, from low blood pressure to sleeping better, to better digestion, to less aches and pains. It's amazing what can be achieved.
Talk to me a little bit about the importance of the thoughts and feelings that we allow into our brain, and how they can affect our daily lives.
Yeah, absolutely. I think it's a fantastic question, because this is fundamental to everything. We could talk literally for hours on this. Professor Bruce Lipton, who's a cell biologist, cloning human tissue cells, was able to show that that our thoughts, our feelings have a direct influence on how our body functions. So that if somebody woke up this morning and perceived their day to be negative, well, technically they're telling their body it's going to be negative. So what happens is that when you have a thought or a feeling, this information is it's an information that signals the brain. And in the brain you have a gland called the hypothalamus. And the hypothalamus is a chemical producing factory. So when you have a thought, that thought sends a signal to the hypothalamus. The hypothalamus then produces the biochemistry based on what you're thinking. So if you're thinking that you have a problem you can't get rid of, if you're thinking you can't be healed or cured, if you're thinking that today is going to be a bad day, you're not going to be successful in your exams, or you're not going to be successful in business or relationship, if that is your thought, if that is your perception of yourself, you are creating the biochemistry that is going to make that happen. What we think, what we see, and what we believe, we absolutely create. So it's very important that people understand that our mindsets is sending a signal to every cell of our body, and we are creating our own problems.
Gut microbiota, or gut bacteria, helps the body to digest certain foods that the stomach and small intestine have not been able to digest. It plays an important role in the immune system, performing a barrier effect. We now know that bad gut bacteria can lead to a number of modern-day serious illnesses. Taking into account the important role it plays in the normal functioning of the body, it is sometimes actually referred to as an organ. Fergus Shanahan is Professor and Chairman of the Department of Medicine at University College Cork, the National University of Ireland. He has published more than 450 scientific papers and several on the medical humanities, and has co-edited several books. He is a Fellow of the Royal College of Physicians in Ireland, Canada and the United Kingdom, as well as of the American College of Physicians. He was recently named to the Irish Life Science 50. It's a list of the top 50 Irish and Irish Americans in the life science industry. 2 years ago, Science Foundation Ireland named him as its Researcher of the Year. Gut microbiota and inflammatory bowel disease are just two of his interests. Microbiota, he says, is one of the hottest areas of research at the moment.
Yes, I think it's no overstatement to say that the microbiota has become probably the hottest area, not just in medicine, but in all of bioscience, mainly because we are now able to study this living material in ways that were not possible until very recently. And when you say you are what you eat, well, that's something we've all believed to some degree, but now we can actually show that there is a scientific justification for that statement, because when you eat, you're not just feeding yourself, you're also feeding the microbes that are present in your body. And these microbes generally are a health asset, a health benefit. So what's good for them is good for us. And a broad diversity of food actually ensures a diversity of microbes, whereas we're quite vulnerable if we've very limited varieties of microbes in our body, because we don't fight infection as well. There isn't as much competition then. And a diet that's reduced in diversity is unfortunately a risk factor for having reduced diversity of microbes and increased risk of infection.
So where exactly are we with this research at the moment? Where exactly are you and your colleagues at the APC and UCC at the moment?
Well, the APC is a research centre that comprises about 150 staff, students and scientists. It's funded by Science Foundation Ireland and also by industry investment. And they work collectively for a variety of different backgrounds, but they basically work in three broad areas. The first one is to see, can we therapeutically manipulate the microbiome, the microbiota? Can we make them better? Can we improve their health-conferring benefits? The second area is, can we use the microbiota, by analysing them, can we look for new biomarkers or diagnostic markers that could predict your risk of disease, such as your risk of getting colon cancer? And the third area is, can we mine the microbiota? Can we extract new things from the microbiota? They're providing all kinds of health beneficial signals, so could we mine them? And if you think about it, most of the drugs that we use in daily life at some stage extracted from living material in the wider environment. So we've been exploring the possibility of mining the inner environment for new drugs or indeed functional food ingredients that could confer a health benefit, such as new antibiotics.
So would it be true to say now that in the future doctors can look at gut bacteria and it could become a way to diagnose certain diseases earlier, like type 2 diabetes, heart disease, even cancer and autoimmune disease?
Oh, John, it's even better than that. The composition, the nature and variety of bacteria in your bowel is almost certainly unique, almost as unique, we think, as your fingerprints. So it would even have forensic capabilities. In other words, we could identify you from the bacteria in your poop. So that shows you how specific it is to an individual. So when you know that, we've been studying, for example, the elderly population, and we've been able to show, particularly my colleague, Professor Paul O'Toole, he has shown that he can, first of all, from examining the bacteria in the bowel, he can tell you what the person's diet is, and he can tell you if it's adequate or not. And not only that, if the diversity of the bacteria in the gut, in the stool that someone passes, if that is reduced in some way, he can actually correlate that with increased risk of certain diseases, certain infections, and even frailty. So people who are quite frail and elderly, they frequently have a very low diverse diet and in turn a very reduced microbiome, which renders them very susceptible to various kinds of inflammatory and infectious diseases.
And that's the end of part one. I'm in Mallow this evening to meet Michael O'Doherty, who's been involved in the field of healthcare for the past 25 years. This, in fact, is the first of a two-part programme in which we look at the connection between gut bacteria and serious illnesses like type 2 diabetes, cancer and autoimmune. We also look at the pros and cons of statins, cholesterol-lowering medication. As well as Michael O'Doherty and Professor Fergus Shanahan, I'll also be joined by vascular and endovascular surgeon Professor Sherif Sultan from Galway. Part 2 in Programme 1 is on the way. Welcome back to part 2 of Programme 1. I'm in Mallow this evening to meet Michael O'Doherty from Ennis in County Clare. Michael is a bioenergy practitioner and has been involved in the field of healthcare for the past 25 years. Among his patients are Michael Flatley, Brendan Grace and Atomic Kitten's Natasha Hamilton and Liz McLarnon.
I suppose Michael's situation is well documented internationally, actually, that Michael suffered from burnout, like a lot of people do. Chronic fatigue is a huge issue in our society, and we see people coming to our clinics every day. Probably 5 people a day, John, will come to us for treatment suffering from chronic fatigue, burnout. And we say to them, okay, if you're suffering from chronic fatigue or burnout, it's taken so many years for that to happen. It's going to take a minimum of 6 to 9 months for the body to recover, provided you're willing to put in the effort. And in Michael's case, Michael, you've got to understand, created a show called Riverdance, spent 10 years touring, working hard, dancing. He was a super athlete, okay? Choreographing shows, dealing with media, travelling, all of these things, huge demands. But ultimately, we would all come to a point when, if we push ourselves, the body will break down. Suddenly, Michael, while he was physically strong and fit, his energy system, okay, the energy system we talked about, that was depleted. In every cell of our body, we have a mitochondria. That's the battery of the cell. And what happens is that, like your cell phone, if your battery goes down and you don't charge it, well, you can't access the information. In the likes of Michael's case, where he suffered from complete burnout, he had 50 best medical doctors in the world. He had 200 medical tests. Nobody could find out what was wrong with him. I have 25 years of experience in working with this area. I was able to say to him, great, you have all the medical analysis done, now everything is fine. Now what we need to do is work at the other levels. We work to get the energy flowing, we work to get on the right nutritional program, the right exercise program. We got his mind focused towards gravitating eventually towards getting back to doing a world tour, which he did subsequently afterwards. And as a result of that, change in his lifestyle, understanding the impact of the stress and the burnout in his life, his body was able to recover, from what we did. And he hasn't been afraid to get the message out there, to tell people that there are other ways. And that's what I like about him, that he's gone out of his way internationally to say to people, look, if you're ill, there are many ways, and taking a positive approach like what we do is what's helped him to get back to full health.
And Brendan Grace.
Brendan, yeah, well, Brendan is a great guy. I mean, again, when Brendan came to me, Brendan had suffered from diabetes. It's a big problem in our society, as I said earlier. One of the key problems that Brendan had when he came to us, everybody knows his situation. He had 2 toes amputated. He had huge infection in the feet, and it wasn't healing. And he was receiving fantastic medical attention in the Blackrock Clinic. He, had a very fantastic GP in Frieda Carmody, also in Killaloe. And my work then, in conjunction with all of that, was to get the energy flowing. Because when we get the energy flowing, we get the blood flowing. Energy carries blood, oxygen, and nutrients. So when we get the energy and the blood flowing, it helps to heal. And this is what happened, Brendan. When we got the energy flowing, it got the circulation flowing, and as a result of that, his body then started to heal. And that was the real key to it. When this system was initially developed, going back 30 years ago, in former Yugoslavia, now Zadar, Croatia, the system was used to treat gangrene and conditions like this, and proved very beneficial. So a lot of people out there, for example, who have diabetes and they're taking insulin on a daily basis, you have 60,000 miles of vessels in your body. 60,000 miles of vessels in your body. That's a lot. And, these are responsible for transporting information and nutrients and eliminating waste out of the body and so on. And what happens is with diabetics, I find, is that the microcirculation gets blocked off. The tiny capillaries get blocked off. The insulin intake makes the blood very syrupy, sort of thing. And we find that if we can get the energy flowing, that it helps to open up that microcirculation. Those tiny capillaries get blocked off, and it's hugely helpful. People often think, well, just because they take insulin, whether it be injection or tablet form, well, I'm a diabetic type 1 or 2, and I can take this medication medication and it solves my problem. It doesn't. Sometimes we're insulin resistant. Sometimes people don't respond to the insulin at all and they don't understand how to take it. People use pumps nowadays, and I'm not totally gone at that either. But, the whole management of diabetes, if it's done right and properly with the right professionals around it, you can live a perfectly healthy, normal life without having to end up like Brendan did with, amputations and circulatory issues and infection.
Our two main subjects of discussion over the course of these two programmes are, firstly, the pros and cons of cholesterol-lowering statins, and secondly, gut bacteria. Researchers, scientists and doctors now believe there is a vital connection between microbiota and the serious illnesses of today. Michael Doherty agrees.
Professor Fergus Shanahan has clearly publicly stated that from a part of UCC again, he says that, the diversity of what we eat has a direct effect on the diversity of the gut bacteria, okay? And that in turn has a direct effect on the types of diseases that we can develop, like cancers and cardiovascular diseases and inflammatory type disorders and so on. Now, what I mean is that we're just beginning to learn that the microbial system, the bacterial sort of colonization of the gut, and we have bacteria all over us in our skin, microbes all over our skin. In The Economist magazine recently, microbes make it the man. Anybody can research that. They can also research Professor Fergus Shanahan's issue that I just talked about and what he says. So the bacteria in the gut is fundamental. That if we damage the gut bacteria by excessive antibiotics, by excessive acidic forming foods, by high levels of sugar, making the system acidic, then what happens is that gut bacteria, if it's damaged, it weakens our immune system. It leaves us susceptible to health. And we think because we eat yogurts, that it solves our problem.
Yeah, probiotic yogurt.
Probiotic yogurts.
If you hear a problem with the gut bacteria, probiotic yogurt.
People need to get away from this massive advertising campaigns that are going on about, take this, that or the other. What we need to understand is the type of colonization that takes place in the gut is so different to that. We know that if you have the Helicobacter pylori bacteria, H. pylori bacteria, you will develop ulcerative colitis, even possibly Crohn's disease. Okay, so we know that the gut bacteria affects our digestive system. We look at a lot of the irritable bowel types of problems, often by taking a good probiotic regularly, taking a good digestive enzyme to break our food down, removing the acidic forming foods, removing the mucus forming foods. Suddenly the gut bacteria is rectified and balanced, and suddenly the body starts to heal. We see this hugely in our clinics, where children come into us. This time of the year, we see kids coming into us who have respiratory issues, taking loads of antibiotics. The abdominal area is bloated, they're nasally. And while we would always advise patients to consult with their medical doctor first, we would then look and see what the problem is. We get the energy flowing as we outlined earlier. We change the child's diet. We get the proper bacteria in through whatever means, whether it's something like Simprove, which is a liquid bacteria, or you take the likes of, Partic Alpha does some stuff and things like that. There's lots of different stuff you can get in the health shop. But if you take the likes of that in, suddenly the child starts to recover within 24 hours. Body temperature drops down. Everything is affected by the gut. And if we were to get the gut right, if we were to remove all of the acidic forming foods, the mucus forming foods, get the bacteria and enzymes right, you'd be amazed what can happen in everybody's life.
When we spoke to Professor Fergus Shanahan earlier, he mentioned that the bacteria from a person's stools is like that person's unique DNA, and so much information on the person's health can be gained from it. Well, you may be surprised to hear that doctors are now carrying out fecal transplants, or stool transplants, on patients with difficult-to-deal bacterial infections. But Fergus Shanahan says that this is far from being a new procedure.
Fecal transplant is a fancy modern word for something that's actually an old treatment. There are references going back to even the Ming Dynasty in China. When I worked in the United States, I recall old physicians referring to even older physicians using fecal enemas. In other words, enemas, feces from a donor, which were diluted in water and administered per rectum as an enema, which were used to treat what we now know are certain kinds of infections. But back in those days, they didn't know what the cause of the infection was. And they were treating some of these so-called superbugs, Clostridium difficile, which is a common superbug that is acquired after antibiotics in the elderly in Irish hospitals and hospitals worldwide. But they were doing this generations ago. So it's newly popularized and validated, but it's not at all a new treatment.
So for people who have been following, say, long-term good dietary changes, would it be true to say that still, because of their genes, they could still be scuppered?
Well, if you follow a good diet and if you just take antibiotics when necessary, not injudiciously, because unnecessary exposure to antibiotics is harmful to the microbiome. It is true there are certain diseases that the microbiome can't have any influence on, but you need more than genes generally you need more than genetic susceptibility to develop most chronic diseases. You need something else, and it's usually some sort of environmental stressor or impact and bad timing. So most of the chronic disorders such as asthma, arthritis, inflammatory bowel disease, multiple sclerosis, systemic lupus, most of these chronic immunologic disorders have become much more common in recent times as we have moved from developing to socioeconomically developed nation status. These things have become more common. Now that cannot be explained by a change in the gene pool. So we've always had those genes. Those genes are common in society, but something else has happened. And the conditions of a modern lifestyle have changed the microbiota, the bacteria and viruses that live in and on our bodies. They've changed those, and they're important from the point of immune development. So an impact of lifestyle and environment on our microbes is going a long way to explaining why genes alone aren't enough to give you a disease, but also explaining why these conditions are becoming more common in society as we undergo socioeconomic development.
And people may not be surprised that bad gut bacteria may affect us when we talk about heart disease and cancer, but they may be a little surprised that this can affect autoimmune diseases as well.
Yes, at first sight it does seem surprising, but not if you think about a germ-free animal. That's an animal who's born without any bacteria whatsoever. And people have done these experiments 50, 60 years ago. An animal that's raised in the absence of bacteria has a very abnormal immune system. In other words, we need bacteria to colonize our bodies, to educate our immune system, to make it behave appropriately. And likewise, if we are exposed to antibiotics early on in life, causing a disruption of our microbiome, our microbiota, then the education of the immune system is also disturbed, and therefore it's no surprise that antibiotics are now increasingly being shown as a risk factor for the development of these autoimmune conditions. And the earlier the exposure to antibiotics, the greater the risk. So exposure to antibiotics in the first year of life is a risk factor for asthma, it's a risk factor for Crohn's disease and ulcerative colitis, and it's even apparently now a risk factor for the development of metabolic diseases such as diabetes and obesity.
Say a person reads in the morning that, for instance, blueberries or broccoli is good for gut bacteria, and they decide to concentrate mainly on blueberries. I'm going to eat loads of blueberries and that's going to be good for me. But I believe the secret here is, and the key word is diversity. Yeah, the key word is diversity. And whenever a celebrity or some show person says they've got some major new diet that really smacks of being a food fad, it's usually incorrect. Most people will follow a good, healthy lifestyle if they just take a small amount of everything, diversify the diet, and nothing in particular to excess is not bad advice at all. Professor Fergus Shanahan from UCC. Coming up in part 3, Fergus Shanahan speaks about the beneficial effects from positive dietary change. And from next week's programme, we preview vascular consultant surgeon Professor Sherif Sultan's views on statins prescribed to lower cholesterol. Welcome back to part 3 in the first of 2 programmes. I'm back in Mallow with Michael Doherty, a bioenergy practitioner who has come to meet me from Ennis in County Clare. Part of Michael's health programme, an important part of it, looks at the mindset of the patient and how he or she deals with their emotions. He points to placebos as a good example. A placebo is a medical treatment of no effect given to a patient to deceive them. If the patient is convinced that the treatment is actually of benefit, his or her mindset could actually render the medication successful.
I think what needs to be understood is this. I want to explain something to people. Is this: if a multinational drug company has to license a drug into the market today, for any drug to be licensed into the market today, what you have to rule out is the placebo effect. Okay, now placebo means you have to rule out the mindset of the patient. Okay, so if you have 100 people that have depression, you give 50 of them an antidepressant and 50 of them a sugar pill. The results are the exact same. Now that's a huge relevance. To think that 35% of these people are going to get better just by thinking that what they're taking has an effect. Now that's a very powerful tool to work with, but we push that aside. So we already know the science has already been established by multinational drug companies. It's criteria. We have to rule out the mindset. You influence everything in your day, in your life, by what it is you think and perceive. And yes, people can go down the road of visualizing about a big house and a big car and all that. That's all fine. I deal with people who are multi-billionaires. But, the material world isn't necessarily what it's about. It's a little bit more than that. It's a little bit more than just having all of the material things. We need to get back to basis and understand that we can determine our life. We can determine our journey. We can influence everything that's going on in our life. As Professor Irvin Kirsch says, we can alter our experience by what it is we believe about our situation. And this is fundamental in our clinical environment, that we educate people and engage them in a process to realize that if they change the way they perceive themselves, John, that they can have a much better quality of life, that they can overcome their situation, that they don't have, their lives does not have to be restricted just because some consultant said so. What people need to understand about stress is this, that stress is fine. We all need a little bit every day. But when it becomes distress, it's the problem. Now, when you become distressed, what's going to happen is that your digestive system is going to shut down, okay? Your heart rate, your blood pressure, your heart rate is going to increase, so your blood pressure is going to go up. And what happens is that in the gut, apart from bacteria and all of that, in the gut, you have what's called the enteric nervous system. The enteric nervous system is part of your autonomic nervous system. Often people might have thought about, got to get butterflies in the gut. It's the enteric nervous system is that's responding. So the enteric nervous system is embedded in the gut, the esophagus, and the throat. And when we overload the enteric nervous system through the stress, it affects everything. It tightens our gut, it tightens the bowel, it forces the heart to pump more blood and oxygen nutrients around the body, it tightens the actual muscles where we get the neck pain and back pain. It then tightens the cranial plates of the skull, which affects the flow of cerebrospinal fluid, and this causes the frontal lobe headaches. This affects our behavior. This affects our concentration and our focus. We see this with children. It's no different to an adult when they experience stress. So what we have to do is to simply explain this process to people, what they're doing to themselves. And when we teach them how certain ways of confronting that and they apply it, we see that suddenly the digestive system starts to function again because we have released the stress working with the energy. We see that the muscles start to relax because we've taught them certain stretching exercises and relaxation, emotional transformation skills. They have begun to change their diet. Rather than getting into a gym and pumping iron, we've said to them, take you, your husband, your family out for a walk in the wood. Immerse yourself in nature. And when we take that time, and people say, oh God, I haven't time to do that. You make time to do it. You have no choice but to make time to do it. Okay, you get out and you do it. If you put the time and effort in, you reap the reward. The opposite to that, you can exist in illusion, thinking that your health comes in a capsule or a bottle or a syringe. The reality is, it doesn't. It is only until we take control and responsibility of our lives and our health that we can overcome the stresses, the anxieties, the depressions, the digestive problems, headaches, the back pains, and all of the other things that go with it.
Back at University College Cork, Professor Fergus Shanahan has been talking to me about what happens when a person decides to change from a poor dietary lifestyle to a good one. The gut bacteria improves, and the health benefits, he says, are almost instantly recognisable.
Well, the first thing that happens, and it does happen very quickly, if you've got someone who, for example, is what we used to call a tea and toaster, they just drink tea and take toast all day long, and that was a lifestyle of many people in Ireland not too long ago, and still is. The first thing you notice if you diversify their diet, introduce a little bit of spice, if you like, you notice a change in the microbiota within days and weeks, and we know this, we've seen this in the elderly population in particular. That diverse microbiota does actually, first of all, give you increased resistance against the occasional consumption of, say, food poisoning or some infectious disease, because the greater the diversity of bacteria in your gut, the greater the competition against the occasional consumption of what we call a pathogen, a disease-causing bacterium. So they've increased resistance straight away. Their immune system is stronger, and you do see a decline in inflammatory markers. These are, when patients age, when we all age, we undergo what's called immune senescence. The immune system gets a bit ragged and rough, and it gets a bit out of control, and you see greater degrees of inflammation, which increase our bone thinning and actually accelerate aging. You see a reduction in that when you diversify your diet and broaden the diversity of your microbes, because they're modulating your immune system and your inflammatory response.
Before we talk about the good foods, let's talk about the bad foods first. And I think the one food type that keeps popping up constantly, and not only in its raw sense but also in food and in drinks as well, and that is sugar. How bad is that?
Well, sugar is much maligned. I think it all comes down to quantity. A small amount of anything is not bad for anything. It really comes down to a consumption of excess sugar or substituting sugar for what we call complex carbohydrates. In other words, taking something that's highly refined, that gives your system a big hit with glucose, with sugar immediately. That's not the way we have developed. That's not suitable for our metabolism. Whereas taking something sweet in the form of an apple, where one has to digest it, that gives a more controlled exposure ultimately to sugar, but it's a much more beneficial way to do it. But I think that the key word here is it depends on the amount. A small amount of sugar won't do anyone any harm. It's about excess sugar that's the harmful aspect.
All right, and the other bad foods, I suppose, are they, the ones we've been hearing about so long, refined foods, fats, all that sort of thing?
Yeah, highly refined and highly processed foods. We knew long before we knew about the microbiota, we knew that things like that are a risk factor for various diseases, including diabetes, obesity, but even colon cancer. And for years ago, it used to be said that if you run from salad bar to salad bar, you'd reduce your risk of colon cancer. And what they're really saying was a combination of exercise and the absence of highly processed foods, such as the consumption of fibre as well, that would give you protection against colon cancer. And now that we know the mechanism via the microbiome, we're beginning to understand and really believe that kind of advice. But again, it's really all about diversifying diet and not taking any one thing to excess.
Research into microbiota and its effects on our health is one of the most exciting research projects at the moment. So where does Professor Fergus Shanahan and his colleagues at UCC go from here?
Well, we are continually moving again towards looking at new diagnostic markers. We think we'll be in a position to identify risk factors for people for things like colon cancer. We also know that we have new antibiotics that were mined that are naturally occurring in the gut, so they are ready to go to the next phase of development as new drugs. And lastly, we think that we are paving the way for new foods. In other words, foods that would have built-in diversity into them that would be of particular value to the elderly, because they can't, because of their dentition and physiological constraints, they can't eat everything that younger people can eat, but they do still need diversity. It's not enough to have adequate calories and adequate nutrients. You've also got to have diversity. That's staple. It's not a luxury or a spice. It's a staple. So new foods is a new direction for us.
Okay, and just one very quick point before I leave you go. For a person who has been diagnosed with an autoimmune disease, could they possibly see benefits from making long-term dietary changes for the better?
Well, I would never try and tell someone that they can suddenly reverse one of these very serious autoimmune diseases that cause such debilitation for individuals. But yes, everybody can benefit from diversifying their microbiota. But I would never claim that it would be a substitute for the drugs therapy, for the physiotherapy, for all the other proven therapeutic remedies for these diseases. But what I'm referring to is adequate diet and exercise and indeed sleep that can influence your microbiota. That's an important part of the whole story. It's not a substitute, but a supplement.
Currently, it is estimated that approximately 40 million people are taking cholesterol-lowering medication known as statins. It's worth $29 billion annually to the drugs companies. The idea is that dietary saturated fat raises cholesterol levels and between them clog up our arteries, resulting in heart attack. But for some time now, a number of doctors and researchers have been questioning this, claiming that people with high cholesterol live longer and people with heart disease tend to have low levels of cholesterol. Recently, a film entitled Statin Nation 2 was premiered in London. It claims to expose the $29 billion cholesterol-lowering industry and explains how more than 40 million people have ended up taking a medication that they claim is doing them more harm than good. Next week in Programme 2, we speak to vascular and endovascular surgeon, Galway-based Professor Sherif Sultan.
Hardening of the artery or heart attack is not caused by cholesterol. It's caused by stress. It's caused by thrombus occluding the lumen, but it's not caused by cholesterol. Now, the shift back again that when you eat low-fat diet, you are increasing the likelihood for you of having diabetes, the likelihood of you having obesity. And the epidemic of obesity is because of too much sugar. If you don't take fat, you're compensating with carbohydrates and sugar. And that's why the epidemic is happening. And all the nutritionists now coming in. And as you're well aware that in 2010, on the front of the Irish Times, I went on that sugar is much more dangerous than hypercholesteremia and smoking combined. And I was attacked by the food industry in Ireland that I'm trying to destroy because of sugar. Currently now they agreed and they start to decrease their sugar content in their food chain and even in schools. So if we need to do one single stuff, we need to start explaining to the public that they've been brainwashed, that the disease that they are fear of is not from cholesterol, it's from sugar.
At present, I believe you have approximately 40 million people taking statins, and then you have millions more avoiding foods that contain cholesterol and saturated fats. What does that tell you, or what can we take from that?
Okay, that's one of the best questions I heard today. You know, the industry used to be about $20 to $22 billion per year, augmented to almost about very recently to about $26 billion since the statin went out of patent and a lot of other companies went into trying to sell it to other people. The problem, currently, the American Heart Association have put a risk calculator. And everybody was against this risk calculator. That means that everybody have to go on statin. But if you look at it, they never even look at cholesterol or LDL level. This is gone. They start talking about other stuff, changing lifestyle, and they have to sit and talk about it, and you might take a small dose of statin. But they have eliminated the level of LDL or bad cholesterol in the measuring and in the calculator. So they know that, but they're afraid that something going to happen. Currently, the biggest lawsuit in the United States is against two of the biggest multinationals, and the federal law have put a cap of $33 billion for this lawsuit because of statin primary prevention.
And that was vascular and endovascular surgeon, Galway-based Professor Sherif Sultan, who was, of course, expressing his own personal opinions on statins. He joins us on Programme 2 next week. Next week, we also hope to speak to Justin Smith, producer-director of Statin Nation 1 and 2, and we also hope to get the views of the HSE. My thanks to Professor Fergus Shanahan from UCC. Michael Doherty will join me on the programme next week again. And remember, always check with your doctor before making any decision about your health. Thanks to John Foot on sound and you for your time. Until Sunday evening next at 7, this is John Greene wishing you the very best for the coming week.